Providing Medicaid for nearly 80 million Americans is a huge task. The federal government has always taken its role seriously in paying its share of Medicaid costs. But what if Congress decided to cut that federal Medicaid funding? How would this impact the healthcare system we all depend on? Great questions. We'll answer them for you in 90 seconds or less. Start the clock. Congress is proposing to severely cut the amount of dollars it gives to states by lowering the federal match. You may have heard this called FMAP. This is how federal and state governments split the costs of Medicaid. If you remember one thing from these 90 seconds, remember this. Cuts to the federal match would be catastrophic for the healthcare system and the economy. Here's what would happen. Millions of Americans would lose health insurance coverage, many immediately. State budgets would fall into chaos, forcing states to either raise taxes or cut critical programs like education and public safety. American families would face medical debt and economic insecurity, and hospitals would lose an important source of revenue to keep their doors open. Right now, depending on the state and Medicaid program we're talking about, the federal government pays at least 50% and up to 90% of Medicaid costs. States pay the rest. These proposals just put more and more of the responsibility for paying for Medicaid onto states. While shifting costs from one place to another may seem like no big deal, these proposals represent a major shift in how the Medicaid program operates with enormous consequences. And importantly, these proposals destabilize the healthcare system that we all rely on without doing anything to address underlying healthcare costs. Now that you know, there's still time for you to take action and tell Congress to oppose attempts to weaken the Medicaid program through federal funding cuts. How'd I do?